Now to the upcoming flu season and the importance of protecting you and your family. Last year's flu season, it hit Americans especially hard. And joining us now to talk about this is ABC News medical correspondent Dr. Darien Sutton. Dr. Darien, thank you so much for being here. Good morning. We talk about this every year. The flu, it is rough. It can be very, very dangerous. But last year in particular, it was very bad.
It was one of our toughest seasons. If you look at the actual numbers from the weekly morbidity and mortality report that's produced by the CDC, it helps us to understand the number of hospitalizations and the number of complications. Something that stood out from that report, Gio, is that last year we had the highest number of pediatric deaths, children under the age of 5 losing their life to influenza since around 2009, 2010. That was a period of time that included the swine flu. If you look at those other statistics, it's really important. 56 had an underlying medical condition, but more than 40% had no underlying medical condition, and nearly 90% were not fully vaccinated. So it just brings to the main point is flu vaccines do work, and this flu season is not something to be underestimated.
Yeah, those numbers are truly alarming. So when does the flu season, the cold season officially begin? I know people are thinking about when to get their shots, but then also what else can we do to protect ourselves?
Well, we start to see numbers rise toward the end of October, and then that peaks typically around December, and then it can go all the way until the springtime. And of course, that includes not just the flu, but other viruses such as COVID-19, RSV, and rhinovirus that typically causes what we know as the cold. In terms of protecting ourselves, now flu shots are the most important thing to protect yourself, but we all know those mitigation efforts. Covering our mouth when we're coughing, washing our hands as much as we can, and grabbing a mask for those crowded areas, for example, the subway. You want to make sure to protect yourself.
Stay at home when you're sick, too.
And
Sorry, can I just throw that one in there? Just for the coworkers
I
here.
love that you brought that
show
up.
up with the sniffles.
Yeah, doesn't matter what it is. It's something viral. Keep it at home.
If I'm sick, I'm staying home, I promise. But to that point about flu shots, because there's a big push for everyone to get their flu shot, really.
Yes.
But what are the CDC vaccine recommendations for the flu, and who's at high risk?
So the recommendations for anyone over the age of 6 months. Now, the highest at risk are those over the age of 75. Those are my patients that are most likely to be hospitalized. Pregnant and peripartum mothers, so that's near your delivery. You want to make sure that you know you're high risk. And then those who have a chronic disease, asthma, diabetes, heart disease. It's important to remember that the flu is so much more than a fever and keeping you in bed. We want to reduce those risk of complications. That includes pneumonia, worsening of heart disease, and asthma, and making sure that you understand that the flu vaccine is not perfect, but it reduces your risk by about 40 to 60%. That's equivalent to putting on your seatbelt in the car. Think of it that way.
Wow. All right. Really important stuff. Dr. Darien Sutton, thank you so much.